Welcome to the Health or High Water podcast. I'm Tripp, and in this space we talk about health, not as perfection, but as something you build one small decision at a time. These solo episodes are meant to feel like you're in one of my classes. We learn, we have some fun, we stay consistent. If you're here to understand your body better, take ownership of your health, or just feel a little more grounded, you're in the right place. A quick word from our sponsors. Gene Planet Genetic Testing. Without them, we really truly wouldn't be able to individualize our programs. If you're looking to understand what kind of workouts, supplements, diets, injury risk and prevention, cardiovascular disease, and then some, go check out geneplanet.com's premium test. Enter code APT. That's code APT for 30% off your genetic test. So if you guys get it done before February 14th or Valentine's Day, I'll give you guys a free genetic consult if you guys order before then. Remember, that's code APT at geneplanet.com, premium test for 30% off to start your individual journey with genetic testing. So who am I? Why am I even talking on this podcast? I've been in fitness since I was 12 years old, working out with my brothers 18 years older than me. Shout out to Brian, teaching me the ropes. Started writing workout programs at 15 years old. Was the unofficial health chair in my fraternity at 20. Started working for some supplement brands at that time. Owned my own supplement store in my mid-20s where I started getting involved with genetic testing and individual work. Played in a small pro football league. But in 2022, my mom had a stroke turned dementia, and that flipped my life upside down. Our battle with the healthcare system and lack of communication. I mean, it took us 6 months to get an MRI for my mom's brain. It was just absolutely ridiculous, and I just felt like there was no one helping us the way we needed to. I felt really lost, especially with my mom. It was my best friend, and it was really hard. But that got me on the path of preventive medicine. Is how could we have prevented this to begin with? So I started going down the path of getting my recertified in personal training, nutrition, strength and conditioning, genetic-based program design. I wanted to come up with a program that was going to solve these problems. That led me to Denver for a few years, where I worked with Ascend Performance Training. I was going to apply this genetic process to kids. I really thought parents were going to want their kids to figure out what injuries they were having. The demographic I started working with was actually the parents putting their loved ones into senior living communities. And with my mom already being sick and being part of the demographic, I jumped right into that industry, working with seniors and coming up with preventive care programs. But earlier in 2025, I had to come back home because the dementia was getting a lot worse. And I started Through Fire Wellness, where I teach lectures, teach classes, personal train right here in the Cape Fear area, Myrtle Beach area. I've also written a few books based off of these kind of things. But that's who I am and why I'm sitting here. Is this just someone who's been screwed over by the healthcare system and just felt like they're being lied to, felt like we're not making any progress, and people are continually being sick. Why this is so personal for me is, just like I said, I'm watching my mom fall apart, and then other people I work with are falling apart as well. And a lot of these are preventive issues, We got an 83% mortality rate after falls, posture issues all up and down, a lot of atrophy that's going on, people that don't have enough muscle. I don't see it just in my home. I see it everywhere I go, and I really want to make a huge difference in this. One of the big things too is I want to make sure people are making lifestyle decisions over just week and month programs. They just pick and choose. Oh, I'm going to do a workout this month, and then I don't see any goals. Well, I'm going to try a diet this month, and they don't see any goals. They're just picking and choosing what they want to do. One of the other things is we got to take better care of ourselves so we can take care of others. That's a huge thing, right? Because it's not if something's going to happen. If we keep on abusing our body, it's when. So that's why it's super important, as I want to get across, is lifestyle decisions over programming. And speaking of programming, I came up with a process, like I told you guys, called health profiling, because I want to make this difference. The process includes genetic testing, blood work, movement screening, family medical history, and ultimately AI to build 360-degree wellness programs. We don't really look at wellness programs from different perspectives. Like I just said, we pick and choose. I'm going to do a workout this month, or I'm going to do a diet this month, and they all work together. Your body works as a system. We really need to understand individual needs. There's no fishnet approach to health and wellness. I'm sure you've all tried health, fitness trends, what have you, and it works different for everybody. That's because everybody is different. Everyone has different needs. Everyone's workouts are a little bit different for their efficacy. We all have different injury risk and prevention. That way, we could, with the genetic testing, we could build prehab programs so your potential risk can turn into actual strengths. And one of the big things too is, what supplements do I take? What supplements do I need? When we mix your blood work and genetic testing, we can actually figure out exactly what you need. Hey, listen, my metabolism for vitamin D is less than somebody else. So how much vitamin D will I need? Well, I can find out right for you right there. With these quantitative tests, we can really cut through the BS and find out exactly what you need, as well as understanding, potential risk. Hey, what's my lung cancer risk? What's my cardiovascular disease risk? And then coming up with these wellness programs to eventually prevent certain things from happening. And that gets us into our multispectral approach to this, right? If we're talking workouts, nutrition, supplementation, even things like sleep, we're able to get you a lot healthier quicker, right? Because we're attacking it from all sides. I like to think about this almost like you're attacking a castle, right? You're not going to go knock on the front door in just one side. They're going to walk out the back. The only way to truly attack a health and wellness program is attack it from all sides, making sure that we're sleeping well, making sure that we're well hydrated, making sure we're taking the right supplements that we need, the right workouts that work for us, etc. Making sure we're attacking this at all sides to be as effective as humanly possible. And I was also talking a little bit about this earlier about programs and what have you. A lot of us I want to be on a 6-week program to get a beach body, or I want to look like this in 6 months. The idea of fitness being a destination, or there's a perfection to this, and just doing a few weeks or a few months of this is not the ideal outcome for this. Short-term results, short-term outcomes typically don't work out well for us, especially with this. When we're talking about programs, we need to think about lifestyle decisions. Right? This is stuff we're going to do the rest of our lives so we don't see ourselves sick, or try to prevent ourselves from being sick or hurt or weak when we get older. One of the big things too is communication between practitioners and health and wellness professionals. Like I said before, we had a troubled time with the healthcare system. It seemed like we kept on talking to the 3 or 4 different doctors and nurses, and we were saying the exact same things to them. Nothing was being communicated with. It still is a battle, because no one has a health profile, right? Where all these practitioners come in, hey, listen, I saw, you had a good workout this week, but not sleep. What's going on? No one's communicating multispectrally on your health and wellness programs. And that's why I really feel like this healthcare system is not doing you guys any service, especially me a service at all, by not communicating and understanding what our needs are. So why this podcast? Well, if you guys go back to the other episodes, other professionals that I've had on, we've had 130 episodes. Here is, as much as I do know, the more you learn, the more you know that you need to learn. Okay? So what I mean is, as much as I do know with health and wellness, I want to have other people that are smarter than me, know more about certain niches so I can grow, right? I want to be able to learn so I could teach others. So this podcast is about having real conversations about real impact, about health, wellness, fitness, all of the above. I also want to make sure we establish that there is no perfection with this, right? We are constantly trying to learn, reassess, to grow. Perfection's a dead-end road anyway. We just have to keep on practicing at it, and giving up is not an excuse, because we have other people, we have loved ones, we have friends, we have professionals that look up to you. You have no idea who's looking up to you. And we've got to take better care of ourselves, because actions speak a lot louder than words. All right. Then we're getting into kind of the end in here. What's to expect with future episodes? You're going to talk about genetics. We'll be talking about injuries, talking about diets, talking about workouts, hormones, and much, much more. The reason I want to dive into all these different things is I really feel like we're not able to put them together. One professional will talk about, this is the right workout, blah, blah, blah. This is the right diet. No one's really talking about how they fit together and how individual needs need to be done, right? So we'll talk about fat burning variant, RS126788919, basically saying that this person doesn't burn fat the same as someone else for cardio, right? So we have to put them on a circuit-based kind of training. Is understanding these different alleles, variables that could be impacting your health and wellness journeys that could keep you stuck. So we'll be diving into all these into some detail here. Even with some aging stuff too, we have a high population of aging. seniors, and we want to make sure that we are providing them with the right resources and tools to accomplish their health and wellness goals and keep them happy, healthy, and the best quality of life that's absolutely possible. So if this really felt like a class, that's the goal. You don't need to do anything, just something consistently. Start with, hey, I'm going to drink water at lunch instead of a soda. Hey, I'm going to start going to bed at 9. You don't have to start with everything, just start somewhere simple, right? Something that you can repeat. Even something as simple as making your bed every morning can make a huge impact. But these small decisions, when you do them over time, compound in interest and make a huge difference on your lives. So again, if this helped, stick around. There's more coming soon, but thank you for watching Health or High Water, the first solo episode with Tripp, and I'll see you guys on the next one. Talk to you soon.